Hi everyone, welcome back to Self-Care Voyage. To my wonderful subscribers, thank you for joining me once again. And if you're visiting for the first time, a warm welcome to you. Have you given birth several months ago and now you seem to be losing your beautiful hair? Or you probably had a major surgery some months ago and now you're losing your hair. If yes, you may be suffering from a form of hair loss called Telogen Effluvium. And today, I will shed some light on this subject. So Telogen Effluvium, what exactly is this? This is a type of hair loss that does not leave scar tissue. It usually starts suddenly and the shedding is diffuse. There are two forms of Telogen Effluvium. There is the acute type and there is the chronic one. The chronic one usually starts slowly and can last longer. So the acute form of Telogen Effluvium would last less than 6 months. However, chronic Telogen Effluvium will last for more than 6 months. So this condition, Telogen Effluvium, is essentially your body's way of reacting to some form of stress. Maybe hormonal stress, maybe you've changed your medication, or maybe physiologic stress. Someone suffering from Telogen Effluvium can experience hair loss from any part of their body. However, the most obvious hair loss is that of the scalp. However, do not worry because you will never go bald with Telogen Effluvium. Now, for you to understand what goes on in Telogen Effluvium, you have to comprehend the phases of the hair growth cycle. The normal hair growth cycle has several phases. Anagen phase. This is the phase where your strands grow. Then you have the catagen phase. The catagen phase is where your hair stops growing. There will no longer be blood supply to your hair follicle. The hair follicle diameter also decreases in size. And after the catagen phase, you have the telogen phase. The telogen phase is where your hair strand goes into rest and it prepares to shed. So oftentimes what happens is that while that strand is waiting there in the hair follicle in the telogen phase, there's a new strand going through the anagen phase that will push the telogen hair out of its follicle. And that's when you will have shedding. So a strand of hair can be in the anagen phase depending on the person's genetic. So the anagen phase can last for 3 years and in some cases even more. When it comes to the telogen phase, certain hair strands can be in the telogen phase for up to 3 months, and 5 to 15% of your hair strands can be in this phase at any given point. So hair shedding can vary from individual to individual. However, it's generally stated that one person can lose 100 to 200 strands a day. Now, if your body suffers hormonal changes or physiologic stress, this will cause a large number of your hair strands to suddenly enter into the telogen or the resting phase. Now, when your hormones change or there's a physiologic stress, your hair will not fall out right away. Some time will elapse between the trigger and your hair falling out, and this is usually 1 to 6 months. On average, it may take 3 months from the time of trigger to telogen. So for example, after I give birth to my son, 3 months later, I began to notice excess shedding. But what I did during the first week when I noticed excess shedding, I applied rosemary tea to my scalp 2 to 3 times a week, and after that, my shedding went back to normal. So as I mentioned before, physiologic stress can also result in hair loss or Telogen Effluvium. But what are some examples of physiologic stress? These can include maybe an acute febrile syndrome. You suddenly come down with a high fever because of an infection or for some other reason. Or maybe you were involved in a serious accident and you suffered major injuries. Or probably you had to have a major surgery. Other forms of physiologic stress can include liver disease, end-stage renal disease, malignancies, and even lupus. In addition to postpartum shedding, there are other hormonal changes that can result in telogen effluvium. For example, if your thyroid hormones are not functioning correctly. Also, if you discontinue a medication that contained estrogen, this can also trigger this form of hair loss. Now, your diet can also impact how your body reacts to hair loss. If you're crash dieting, if you have low protein intake, if you're suffering from anorexia or chronic iron deficiency, this can also cause your body to allow you to lose more hair than is normal. And for those on medications, you can look at things like your anticoagulants, your beta blockers, medications that control your thyroid hormones, and even immunization can result in telogen effluvium. Now, if you're ingesting excess retinoids, in particular vitamin A, or if you have an accumulation of arsenic or thallium or selenium, these can also trigger telogen effluvium. So how can you tell for sure if you're suffering from telogen effluvium? Well, first you have to look back at your previous 6 months. What happened during the previous time? What happened 6 months ago or maybe 3 months ago? Maybe you changed your diet. Maybe you haven't been eating as healthy. Maybe you started a new medication. Maybe you had a surgery or you were involved in an accident. And now you're seeing that your hair is slowly thinning. You're having a little bit more shedding. However, your hair isn't coming out in patches. The hair loss is from your entire head. Then you can have an idea that, okay, this is not a major problem I'm suffering from. Another thing is, with telogen effluvium, you tend to lose hair from your entire head. So no particular section of your head will have like a bald spot. If you're having bald spots on your scalp, then this is not telogen effluvium and you need to seek medical attention. The other thing with this type of hair loss is that it does not leave a scar and your scalp does not have any form of inflammation. Also, if you were to run your finger along the shed hair, you will find a normal hair bulb at the end of that strand. Now, with the chronic form of telogen effluvium, you may not be able to spot the difference right away because it's an ongoing process. However, if you were to compare all the photos where your hair was once dense to your present photos, you will notice a drastic difference over time. Your hair will appear to be more thin, more lifeless, and it's just not appearing to be as healthy as it used to be. Now, if you suspect that you're suffering from chronic telogen effluvium, it's important that you consult with your dermatologist or your physician because there may be an underlying trigger. Oftentimes, there's an underlying metabolic problem that's triggering this form of hair loss. Maybe your thyroids are not functioning properly or you're suffering from chronic iron deficiency. So, in case of treatment for chronic telogen effluvium, you must treat the underlying cause in order to see your hair grow back and begin to flourish. Now, when it comes to treatment of acute telogen effluvium, I want to encourage you to not panic because once the underlying stressor has resolved, your hair will begin to grow back. However, in instances where you suspect postpartum shedding, as I shared before, You can boil 1 teaspoonful of rosemary in water. You boil it on low heat until the color of the water changes. You leave the tea to cool, then you strain it and apply this tea to your scalp. Now everyone is different, so this recipe may or may not work for you. However, I always believe that it's better to try and fail rather than fail to try. Now, if you've never used rosemary before, kindly do a patch test before using this tea extensively. With postpartum shedding, in addition to the rosemary hair tea application, ensure you're getting enough sleep. I know this is easier said than done, but you can ask for help. Also ensure that you're still taking your prenatals, because you do not stop taking your prenatals after giving birth. You do need to continue for some time. And with regard to the other triggers of Telogen Effluvium, let's say you suspect that maybe your diet is low on iron, then you need to get on your green leafy vegetable diet. Or if you suspect that you have low protein intake, then consume your eggs, consume your grass-fed beef, your cheese, and your milk. Nevertheless, in acute cases of Telogen Effluvium, you don't need to worry. Your hair will grow back. Now, I trust that you found this very short video enlightening, and please continue to take excellent care of yourselves. And until next time, remember, your self-care journey starts now.